Alright, okay, so hello dears. Ayan, so welcome to the second to the last pre-recorded lecture in our class in Immunology and Serology. And for this lecture, what we're going to discuss is the serology, or how we diagnose your autoimmune diseases, alright, or autoimmunity, okay, through serology. So this is actually, diba, for our last part in immunosero, after salmonella serology, what we're going to discuss are miscellaneous topics. Okay, so miscellaneous serology of other diseases, of other infectious agents, alright? And medyo daghan pa ata sila yun, no? Like autoimmunity, you have mga immunogamopathies, like mga diseases of antibody producing cells. Yes, mga immunogamopathies. Also, you have serology of other infectious agents or diseases, which is our next topic after this. And then lastly, supposed to be was COVID-19, no, serology, because again, it's one of very, very important and relevant nowadays, diba? Especially this pandemic. So at least you know already how we diagnose COVID-19 through serology. But because of time, no, so I just included 2 topics na lang. Instead of 4, you have autoimmunity, this one, and also the serology of other infectious agents. Because again, these topics are quite lumalabas sa boards, alright? And lumalabas sa mga review centers, and when I was a 3rd-year student, I did not have a good grasp of these concepts or of these topics or of these tests. Sa review center na sa review na ako medyo mas nakabalo na, alright? So at least as early as now, you get to be introduced to these tests and concepts, so that pag-abot sa review and sa board exam is hopefully, if magawas siya, then of course, you already know, diba? For COVID-19 serology, again, I would have wanted you to include it, but yeah, kulang dyan sa time. And I think it's not really well established, pero wala pa kayo siya sa references nato, no, sa itong books. But of course, there have been already a lot, no, mga journals, you have mga articles, online articles, no, you have from different sources, trusted sources, on how to diagnose COVID-19 through serology and the different serological tests, no. But always take note lang, usually, diba, for COVID-19, you have heard about RT-PCR, yes, which is still the gold standard test, no, for COVID-19, which again you have discussed thoroughly in your molecular diagnostics na subject. And then you have also antigen testing. So you're testing a part of the virus, okay, from your nasopharyngeal swab or oropharyngeal swab. So that's antigen testing. And of course, the rapid tests for antibody, which are again immunochromatographic kits. You already know the principle of that. So you're detecting IgM and IgG. And usually again, when we interpret kits that talk about or that detect antibodies, IgM usually indicate acute or primary infection, and IgG, it talks about past infection. Alright, and in the laboratory for quantifying antibodies to COVID-19, there have been a lot of methods, and usually they focus on enzyme immunoassay or chemiluminescent immunoassay. These are labeled immunoassays that we have discussed, and usually they are incorporated in the machine. Yes, example mga Architect, yes, you will know that. Architect, very popular machine in IS, no, in immunosero, in the laboratory Architect. So it processes a lot of serological tests, and usually ang iyang principle is ECLIA enzyme chemiluminescent or chemiluminescent microparticle immunoassay ganun. So it depends on the machine, example Architect. And in the insert or in the manual of the machine, it's already stipulated there on what is the type of machine or the type of principle that is used. Alright, so that's for COVID-19. No? So again, I would have wanted to explain more, but again, because of time, no? So ipapaubaya ko na lang sa review center. So far, wala pa daw nigawa sa COVID-19, about COVID-19 sa mga recent board exams. So we're still in the clear, okay? We're still safe, okay? Marked safe pa ta. But maybe in your time when you take the board exam, basin mo daghan ng questions sa COVID-19. So laban lang, maybe sa inyong internship po na may mga lectures about it. So don't worry. Alright. So for this first part of our miscellaneous topics, now we're going to talk about autoimmunity. Alright. So we have started with autoimmunity, actually just a short description when we talk about rheumatoid arthritis, because rheumatoid arthritis is a type of autoimmune disease. Alright. So we'll go further into the different types of autoimmune diseases. Alright, so what is again autoimmunity? In the early 1900s, there is this particular person, di ba? We like history. Gusto natin ng history, di ba? Alright, and can you guess, kasi siya na person, very popular talaga siya. Gas-gas na pangalan niya. Alright, so in the early 1900s, si Maboy, atong bestie, alright, si Paul Ehrlich, he noted that the immune system can attack the very own, the very body or the very entity that it is designed to protect from. It can attack, no? It can attack our very own immune system or our host, okay? And this phenomenon, he described it as a horror autotoxicus, horror autotoxicus, or the rough translation is fear of self-poisoning. And then later on, this condition was then known to be your autoimmune diseases. Alright? It was Paul Ehrlich who discovered it first. Okay? Siya yung nauna. Alright? Okay. Siya yung nauna pero hindi siya yung kailangan. Huh? Char! Yes, paubaya. Anyway. Alright. Ayan. So Paul Ehrlich, again, the term horror autotoxicus, which again translates to fear of self-poisoning. Alright. And later on, this condition was known or was discovered to be your autoimmune diseases. Alright, now what are autoimmune diseases? Your autoimmune diseases, these are disorders in which your immune responses, your very own immune system, are targeted toward your self-antigens and they result in damage to organs and tissues in the body. So, very self-explanatory in the way. Nasa pangalan na, it's autoimmune. So your self, your own self, no, is attacking your own healthy cells or it's attacking your own self-antigens. Okay, because again, under normal circumstances, these cells or your immune system would have ignored, okay, or would have not attacked your self-antigens, okay, because they know, alam nila na it is part of them, or it is part of the body, it is part of the host, alright, okay. But, yeah, so these harmful effects can be caused by T-cell mediated, so meaning cell mediated siya, so in the form of mga cytotoxic T-cells ba, alright, or of course, autoantibodies, alright, so your own B cells, plasma cells produce antibodies against your own self-antigens, okay, ayan. Alright, now for the etiology or what is the cause of autoimmunity, it's not precisely known, but it's mainly attributed, or one of the main mechanisms as to which they believe, autoimmune diseases came from is because of the lack or the loss, okay, the loss of self-tolerance, diba? You have, I think you discussed that already in your immunoserolect with Ma'am Hedy, in the maturation of your T cells and B cells, diba? It's part of their maturation that there is a stage there that they know how to differentiate between self-antigens and between those that are not coming from the self, okay? But in this autoimmunity, or in autoimmune diseases, they lack or nawala ilang ability to differentiate between asa akua, okay, asa jud ang antigens na akua gyud, and the antigens that come from other sources. Alright? Ayan. So again, self-tolerance, ability of the immune system to accept the self-antigens and not initiate a response against them. So basically again, in autoimmunity, nawala ang ability of your immune system to recognize kung unsa jud iyaha, alright, o kung saan dili. Ah, my gosh, been there. Charot. Kinsa man jud ako o dili. Char. Okay, alright. So I feel like we have experienced autoimmunity in the not the disease but the condition in real life. Charot, okay, drama. Anyway, alright. So again, self-tolerance. But aside from self-tolerance, there have also been other possible causes. There are other possible causes that may cause autoimmunity. Alright, and number one of that is maybe due to genes, genetics, and usually when we talk about genetics, it's mainly attributed to your MHC, your major histocompatibility complex, your HLA, your human leukocyte antigen. And usually those, if it's within your family that they develop autoimmune diseases, then because of genetics, you also have the possibility to develop one, alright? Because again, of genetics, HLA. It would depend on the HLA that you inherit. It would depend on the HLA that you inherit for the type of autoimmune disease that you will have, okay? Alright, again. Another cause are hormonal influence. Women are more prone or tend to be more prone because again of hormonal changes, hormonal influence, alright? They can lead to autoimmunity. Alright, or women have a higher chance of developing autoimmunity than men. Okay, because again of hormones, women's hormones can be quite, changing. There could be a lot of imbalances, diba? So yes, muna siya. So women are more prone to autoimmunity. Alright, aside from that, you have tissue trauma and the release of cryptic antigens. So when you say cryptic antigens, these are antigens that are hidden from within the deeper tissue of the host, alright? And then when there are trauma, these cryptic antigens will then be exposed, okay? Because these are cryptic antigens, meaning antigens na natago for the longest time, alright? So wala pa prior sensitization or wala pa siya na-ilhan sa immune system. So if ma-release na siya sa body into the system because of trauma or whatever, so these cryptic antigens, because these cryptic antigens again can natago for the longest time from your immune system, from your cells. So these, once they are introduced into the system or once they are exposed in the system, your immune system will then consider these as something that is foreign, okay? Or something that is not part of the host or part of the body. So of course, they will attack these antigens, alright? So cryptic antigens. And aside from that, you also have microbial infections, example, in the form of molecular mimicry. So what do you mean by molecular mimicry? Parts of the bacteria or parts of your microbes have the same structure with your self-antigen. So example, diba, in Streptococcus pyogenes, in rheumatic heart fever, the antibodies against the antigens of S. pyogenes will cross-react with the heart antigens because of same structure. Ayan. So in a way, that's a rough example. That's the point of molecular mimicry. The structure and antigens of your bacteria or microbes have the same structure, or antigens of your microbes have the same structure with your self-antigens, okay? So, molecular mimicry, di ba? Mimicry meaning gaya-gaya, okay? Ginaya niya, alright? Gaya sa Pilipino. Gaya-gaya, okay? So, in a way, because they have the same structure, so of course, your immune system's response supposed to be to the microbes antigens will then be directed to the self antigens, because again they think, or your immune system thinks that it's the antigen coming from the microbe, but in reality it was from the self, or it was a self antigen, because again of same structure or same molecular configuration, etc. Okay, all right, and other causes. There have been a lot of postulated causes to your autoimmune diseases, alright? But again, the primary talaga na parang the central reason or the central mechanism as to the development of autoimmunity is through the lack of self-tolerance, alright? So your immune system cannot distinguish or have lost the ability to distinguish which is between which are self-antigens and those that are coming from other sources or from pathogens, okay? Alright, ayan. Now we go into your autoimmune diseases. Your autoimmune diseases are classified into two major categories or major groups. The first one is your systemic. So when you say systemic, these are autoimmune diseases that affect the whole body, okay? So affect all organs. So multi-organ siya, right? So systemic, okay? And very good example is of course the very popular SLE, lupus, systemic lupus, erythematosus. Of course, the second one is of course our previous lecture, which is on rheumatoid arthritis. And lastly is of course granulomatosis with polyangiitis, or your Wegener's granulomatosis. I'm sure you're familiar with that. This has been introduced in your AUBF, diba? Alright. So these are systemic disorders. And of course, the second type is organ specific. So when we say organ specific, nasa pangalan na, it's an autoimmune disease that targets a specific organ. So example, it only targets the liver, it only targets the thyroid, it only targets your stomach, etc. Alright? And first example is of course autoimmune thyroid diseases. You have Hashimoto's, Graves' disease, okay? You have type 1 DM, which attacks your pancreas, diba? Inside the cells, you have the beta cells in the islets of Langerhans. Ako, sana naman, first the buzzer na. Okay, alright, ayan. And you have the celiac disease, which attacks your, I think, intestines, alright, okay? And then you have autoimmune liver diseases, primary biliary cirrhosis, something like nalimot ko sa uban, but yeah, autoimmune liver diseases, multiple sclerosis and myasthenia gravis, and lastly, Goodpasture syndrome. So familiar again with Goodpasture syndrome and multiple sclerosis, lumabas. You have discussed that in your AUBF, okay? So for this lecture, what we're going to focus on are the serology of systemic, okay? Starting with SLE and then Goodpasture's granulomatosis, okay? So we'll focus on that in this lecture. SLE, granulomatosis, alright? Because for organ specific, it's more on detecting each organ-specific disease, autoimmune disease, they have their own specific antibodies or autoantibodies then. And that's what we're going to run through lang in the organ-specific, alright? But the major bulk of our lecture will be on systemic, okay? Alright, so we'll start now with the first systemic, which is of course the very popular SLE, systemic lupus erythematosus. Now, systemic lupus erythematosus is an inflammatory disease, and the peak age of onset is usually between 20 to 40 years. Alright, so very early pwede mo start, no, as early as 20. Actually, ayuban ko na earlier pag yun 20. Alright, so it's inflammatory in condition. Okay, women, as mentioned, are much more likely to be affected, but your 5-year survival rate has increased up to 90% because of recent treatment, no, with your SLE and recent mga treatment maintenance to support SLE. Alright? Okay, ayan. And for etiology, again, there's still no precise parang etiology, but it is postulated to be a complex interaction between environmental factors, genetic susceptibility, and abnormalities with the immune system. And those patients or those patients who have certain HLA types, HLA A1, B8, and DR3, DR3 have increased chance of developing lupus. So if you have that in your genes, no, if you have HLA, kanya sila, A1, B8, and DR3, they are, you are more prone to developing lupus. Okay, all right. And actually, these HLA then A1, B8, DR3, it's not only lupus that you can get. It could also get, you could also have other diseases. For DR3, I think it's type 1 DM, if I'm not sure, if I'm not mistaken. Okay. And then B8 is minimal change disease. Yes, in your AUBF. Sana na remember pa. Yeah, HLA B8, if I'm not mistaken, is minimal change disease in your AUBF. And then for DR3, you could also get DM, type 1 DM, if I'm not mistaken. Okay. Yes, diba? I'm sure na-introduce ni Ma'am Teddy sa lecture different diseases in each HLA gene that you may encounter. Okay, alright. And of course, B27, ako very popular, ankylosing spondylitis. Ako lumalabas ang pores. And gasgas na dapat. Ano na? Press the buzzer na dapat. HLA B27, ako, ankylosing spondylitis. Press the buzzer. Okay, alright. So again, that's for etiology. So again, complex interactions, genetics, environmental factors, and even the presence, especially the presence of some HLA genes. Alright. Okay, now for immunopathology, both B cells and autoantibodies are involved. Okay, so you produce autoantibodies. Okay, and for signs and symptoms, the first is of course non-specific. You involve fatigue, myalgia, weight loss, malaise, okay? But joint involvement ang pinaka-common, alright? Most frequent manifestation, which is similar with your rheumatoid arthritis na symmetric ang arthritis, okay? Alright, but pinaka-common, di ba, joint involvement. But the next most common manifestation is your skin, okay? Your skin involvement na the presence of what we call an erythematous rash, red na rash on any area of the body. And especially, a pneumonic sign, no, or a very common sign of the erythematous rash is the butterfly rash. Yes, the classic butterfly rash, but although it occurs less commonly, alright, it occurs across, okay, across usually the face, okay, alright, the nose and cheeks, and is responsible for the name lupus, alright, Latin meaning wolf-like, alright, and it's considered diagnostic of SLE, pathognomonic siya. Butterfly rash, natin picture later. Yung butterfly rash sa front, okay? Dili na siya blush on. Nayo ba na baka putok na putok lang ang makeup, putok na putok lang ang blush on. Okay? Pero wala siya SLE. Naturally ba na rash din siya, okay? So red from the nose until the cheeks, resembling a butterfly, alright? And this is where the name lupus came from, because in the early century, 13th century, there was this doctor who noted this mga rash, and he thought that it resembled the bite of a wolf. Ayan. So that's why dito na came ang lupus na name. Alright, so he called it lupus or wolf-like, because again he thought that these rashes, alright, mga rash diri or any part of the body, it resembled the bite of a wolf. Murag ipaakan o wolf, lobo, char. Ancient of sea, okay, the bite of a wolf. Ayan. So that's why, hence the name lupus. And the most common cause of death is infection and followed by heart disease. All right, so involvement of everything, no, multi-organ or systemic. Okay, all right. So here's an example of a butterfly rash. As you can see, diba, it's red. It resembles a butterfly. So ito yung wings, ito yung body, diba? All right. So again, pathognomonic diagnostic of SLE. All right. Now for laboratory diagnosis, these are some of the findings in the lab. Some of the first findings are leukopenia, possible anemia, and thrombocytopenia. So there is pancytopenia. No, there's a decrease in the cell lines in your blood. All right. Aside from that, in your hematology too, yes, I think this is your last activity. Second to the last one. I think last activity. The preparation of your LE cell. So, mag-ana ulit ito actually. It would have been fun talaga, nakaka-ano siya. It would have been a fun activity in the face-to-face. Kaya maraming job. Tsaka, yes. Kaya you need to, you use a 15 ml tube by 10 ml and then you put blood in it and then you shake because you want to traumatize. You want to expose the nucleus of another neutrophil. All right. So you need to put a stress. You need to put trauma to the cell so that magawas ang nucleus ng neutrophil. And then if you have LE, you have SLE, or there is another cell that will phagocytize or i-engulf. All right. Ang antibody-coated nucleus of the neutrophil. So the appearance is like this. Ayan. So this is an LE cell. So this is the nucleus, and this is another cell. All right, ang nucleus. Okay, that's your LE cell. Again, you have that in your schema too. Very funny. Okay, sana. Ay, nako. All right. Aside from that, ESR is increased because it's inflammation. Okay, but ironically, ang CRP niya is low or normal. So it's part of the pathogenesis nila. Alright, okay. And serum complement levels are low because again, because of SLE, they have autoantibodies, no? So for autoantibodies, they attack, your antigen. So they form immune complexes inside your body. So when there are immune complexes, of course, the complement system is triggered or activated. So therefore, magamit mo ang complement levels, magamit mo complement. So usually in autoimmune diseases, your complement levels are low. All right, there's hypocomplementemia. Basta hypocomplementemia or low complement levels. Usually in autoimmune diseases. Okay, because again they are used up, brought about by the presence of immune complexes. Okay, in the blood or in the system. All right. Okay, and the very first test, very common test, and the most widely used test na gina-perform if SLE is suspected is the detection of your antinuclear antibodies or ANAs, alright? ANAs, alright? Antinuclear antibodies, because these are present in the majority of patients with the disease. But antinuclear antibodies, later na lang. That's our next slide pala. Okay, alright. So these are some of the laboratory diagnoses, alright? But we'll focus more on the detection of antinuclear antibodies, alright? Okay. Now for antinuclear antibodies, by the name itself, these are autoantibodies that target the antigens of the nuclei in the mammalian cells or in human cells, alright? So these are autoantibodies directed against the antigens in the nuclei. So dito yun sa nuclei sa inyong mga cells, diba? So dito yun sa sulod, alright, of the cells. So that's why antinuclear, alright? They're attacking the nuclei mismo of your cells. Okay. They are present over in 95% of patients with SLE, but the downside lang is it's not specific for SLE. Why? Because other autoimmune diseases may also have antinuclear antibodies. You have rheumatoid arthritis, na po siya antinuclear antibody, alright? But it's not specific. But because again of the premise that antinuclear antibodies are present in majority of the patients of SLE, we perform the test pa rin, okay? Alright, ayan. So, because again, it can be found in 95% of the patients, it is used now as a major marker of your disease. But again, the downside lang is it's not specific. Okay? Alright, because again, it can be found in other connective tissue disorders and other autoimmune diseases. Okay. Alright, ayan. Now, the nuclear antigens they are directed against can be varied, wide range of nuclear antigens. they can have, or these antibodies can attack your double-stranded DNA or single-stranded DNA ba, your histones, di ba? You have nucleosomes, centromere proteins, and extractable nuclear antigens. So as you can see, these are all mga components of the nucleus, okay? Di ba? Can you recall mo bio? Yes. Basic bio, anatomy, physio? Yes. Okay. Alright, so components of the nuclei. Now, these extractable nuclear antigens, these are mga nuclear antigens that were isolated from saline extracts of mammalian tissue. Alright, so they were only found, okay? These were nuclear antigens that were only found after extracting mammalian tissue in saline extracts, okay? And these DNAs can be in the form of your ribonuclear proteins, the SM antigen, yes, SM antigen, may mga ROB antigen, charot. Hi, Dr. Mark, you're not funny. You have SSA-RO, SSB-LA, and SCL70, JO1, and PM1. PM, yes. Manginasa. Okay, okay, ayan. So these are mga... May manginasa. Anyway. Okay, so these are antigens, extractable nuclear antigens. Because again, extractable nuclear, meaning they were only found out to be present or they exist pala after lang they were extracted in saline extracts in mammalian tissue. Okay? Now these, again, antigens, they have their own antibodies against, they have their own counterpart ng mga antibodies, alright? And these now, antibodies are what we detect in our testing for autoimmune diseases. Alright, okay, now for the next video, kasi medyo mahaba na. So we'll start now with the different types of your antinuclear antibodies, alright? And then continue to the testing and then to the organ specific, alright? So I'll see you on the next video.